Joshua Long, and for today I am going to perform the return demonstration of the heart and central vessels, peripheral vascular system, and lastly the abdomen. So now I am going to assess the heart and central vessels first. So the first thing we need to do is to gather all the equipments, the stethoscope, um, the pen light, ball pen, and extra marker. Also a ruler and a alcohol. So now, sir, good day, sir. I am Joshua Long. I'm your student nurse for the day. So I'm going to assess your heart and central vessels. So sir, may I know your name, sir?
Asli,
Your age,
19,
your birthday, sir.
September 10.
Okay. Sir. So I'm going to assess your heart and your central vessel. So just follow my instructions, sir. And before we start, sir, there's any question you want to ask?
Wala.
Okay, you can lay down right there, sir.
Sleep.
And take off your shirt.
Para magpahinga ka.
Can you put this in your slap down, sir? Okay. So I'm going to your privacy. Close this. Next is I'm going to put some alcohol in my hand or do some hand washing. So now, sir, we're going to start. So now we're going to assess or palpate the jugular veins, and patient is in 15 to 45 degrees. His head is in 15 to 45 degrees Celsius. And now, can you look at your left side, sir? Okay. We're looking for any distinctions. So, jugular veins of the patient is not visible, or there's no any sign of distension. So, we're not going to assess, or we're not going to locate his jugular venous pressure. So, but in locating the jugular venous pressure, you're going to need a ball pen and a ruler, and locate at the highest point of the distension. So next, I'm going to palpate the carotid artery of the patient. So when you look left in your left side, sir. So by assessing or palpating the carotid artery, find the trachea and the sternocleidomastoid muscle. You look in your right side, sir. Okay, so as I observed, the patient's carotid artery is palpating normally, so it's normal. So next, I am going to auscultate his carotid artery in sitting position. So sit here, sir. Now I'm going to use this stethoscope to auscultate his carotid artery. So as I observed, there's no other murmuring or abnormal sound by palpating his carotid or escalating his carotid artery, so it's normal. So next we're going to sculptate the in the heart the four anatomic site of the heart, which is the aortic, pulmonic, tricuspid, and the apical. So now before that, before auscultating that area, we're going to eliminate all the noise in this area. So now we're going to auscultate the aortic first. So while palpating or while auscultating the aortic, pulmonic, tricuspid, and the apical, I can hear the S1 and S2 sound in supine position. Now, can you um, sit, sir? So now while auscultating the patient in sitting position, I can also hear the S1 and S2 sound, which is the lub dub. So it is basically normal. So when you go back to your position, sir, and you can use your t-shirt. So good day, sir. Next, we're going to assess the abdomen. But first, we're going to check the doctor's order, and we're going to gather all the equipments needed, such as this ruler for hypersensitivity test, and this tape measure for the measuring the patient's abdomen's girth, and lastly, this stethoscope for this stethoscope for listening the patient's bowel sound. And before that, we're going to proceed to the hand washing. So good day, sir. I am Joshua Long, and I am your nurse for today. So sir, we're going to assess your abdomen, which is we're going to take off your shirt and going to see your abdomen. Is that okay, sir?
Yes, sir.
So now, can you lie down, sir, and take off your shirt? So I'm going to take some privacy.
Oh.
I'm going to. Yeah. Okay. So now we're going to check the now we're going to observe the abdominal contour of the patient while standing on his side. So the abdomen of our patient is round and flat, and also the scaphoid. So now we're going to ask the patient to breathe and to hold his breath for us to know if there's enlargement of the liver or any spleen. So can you take a long breath, sir, and hold your breath? Okay, so there's no evidence of enlargement of liver or any spleen, and the patient is symmetric contour. So next is we're going to measure the abdominal girth of the patient by putting the tape measure on his abdomen. So ideally, measuring the abdominal girth the best in the morning. Now, next we're going to percast the each of the four areas of the quadrant to determine the presence of dullness and tympany. So now we're going to begin at the lower right quadrant. Okay, as I observe at the sound of the patient's abdomen, there's no sign of and dullness and tympany, so it's normal. So next is we're going to listen to the vascular sounds. So we're going to use the bell of the stethoscope for us to listen to the aorta, renal arteries, femoral arteries, and the iliac arteries. So first, the aorta. Okay, there's no sign of any roots in his um, when listening to vascular sounds. Uh, Test the appendicitis test. So, sir, tell me if you feel pain. Feel any pain, sir? No, no. You feel anything, sir? Okay. So next, can you lay down, sir? The side. Side. Now we're going to do the SOA sign. So you feel any pain, sir? Huh? Next is for the obturator sign. We're going to. Do you feel any pain, sir? Next is for the hyper sensitivity sign. Tell me if you feel pain, sir. Feel any pain, sir? Lastly, we're going to perform the Murphy sign. So tell me, sir, if you feel any pain. So when you inhale, sir. Exhale. Do you feel any pain, sir? Inhale. Exhale. Do you feel any pain? Okay. So that's all for the assessment for the abdomen. So good day, ma'am. I am Joshua Long and I am your student nurse for today. So may I know your name, age, and birthday, ma'am?
I am Macy. I am 19 and my birthday is October 5, 2002.
Okay, so for today, ma'am, we're going to assess the peripheral vascular system. So, but before that, we're going to do some pregnancy. So now, ma'am, we're going to start the assessment with your arms. So first, we're going to palpate or inspect the bilaterally for size and presence of edema. So okay, your skin is equally bilateral, and there's no sign of edema. So your skin color is light brown, and I'm going to inspect your fingerprints, ma'am, for any clouding. Okay, there's no sign of clogging. So now I'm going to palpate your temperature using my dorsal surface of my hand. Okay, your temperature is warm and not too cold and not too hot, so it is normal. So now I'm going to determine the capillary fill time or the branch test. Okay, it's normal because the color came back in a second. Next, I'm going to palpate your radial, ulnar, and your brachial pulses. Okay, so I can hear the pulses, ma'am, so it is normal. So now I'm going to palpate your epitracheal lymph nodes behind your elbow. Okay, there's no signs of lumps and lymph nodes, so it's normal. So now for the last one, we're going to perform the Allen test. Can you open your close, open, okay, then close, open, close, open. Okay, so the color of your palm came back in a second, so there's it's normal, ma'am. So now, ma'am, we're going to assess your legs, and we're going to inspect your skin color bilaterally in a supine position. So can you lay down now? Okay. your skin color is equally bilateral, and also your hair is not too thin and not too thick. So next we're going to inspect for any lesions or ulcer. Okay, there's no sign of any lesions or ulcer. So next we're going to palpate your superficial inguinal lymph nodes. So I'm going to cover you some blankets, ma'am, for your privacy. Okay, there's no sign of lymph nodes, so it is normal. So next I'm going to palpate your palpate and auscultate your femoral pulses over artery. So I can hear the pulse, ma'am, so it is normal. So next I'm going to palpate the popliteal and dorsalis pedis and posterior tibial pulses. Okay, so I can feel the pulses, so it's normal, ma'am. So next, I'm going to inspect your if there's a varicosities, ma'am. So can you stand up, ma'am? And there you go. Tapos yan. Okay, there's no sign of varicosities. So, thank you, ma'am.